So here we're going to talk about the vestibular system. The vestibular system is probably the most important structure when it comes to a lot of concussion and brain injury symptoms and a lot of neurological symptoms in general. The vestibular system is super important because it helps us understand where our brain is and head is in space. So if we can't understand where our head is in space, then there's a problem. And if we're not understanding that, then there's a lot of compensations that occur throughout our body to help us mediate this challenge. So if we want to understand how important the vestibular system is, what we want to understand is what it's connected to, what it contributes to. So one of the main things that it does is it fires in through the cerebellum and into the brainstem, and it goes up to the eyes, and it helps it controls all your visual motor movements, contributes to all kinds of activities up through there. And so when there's a problem in the vestibular system, we usually have a problem with our eye movements, and could be tracking, could be drifting, could be nystagmus, could be convergence, all these types of things that are really involved that we can use to help diagnose a vestibular issue through specialized testing that we do, through bedside testing, all these different things that we can do. So it fires up to the visual system. What it also does is it fires over to the contralateral, the opposite mesencephalon, top part of your brainstem, and that goes up to the cortex. And so it fires all these other basal ganglionic, motor activities, all these other things that are responsible for, we have to use to coordinate this type of activity. The other thing it does is it's really super important thing that we're really talking about here is it fires down to this autonomic nervous system. And this autonomic nervous system, what it does is it determines how much blood flow gets back to the brain. So its job is then to fire down to the heart and the blood vessels to either tell them to constrict, to push blood back up to the brain, or to not constrict, which relaxes them. We don't get as much blood to the brain, okay? So it's gonna slow things down or it's gonna speed them up, basically, okay? And so if that's gonna get blood back up to these areas, which is really cool. So we have this specialized pathway here that helps do that, and that's called the baroreceptor reflex. So the baroreceptor reflex are these little sensors that live in your carotid arteries that sense if they're being stretched. They send a signal to the autonomic nervous system that tells the heart in your blood vessels, hey, chill out. We're getting more blood than we need. We're kind of stretching the inner tube. We need to stop pumping air into this thing. So it slows them down, puts the brakes on them. Then when that happens, the carotid relaxes. And then when you don't get a signal from the carotid, these sensors, these baroreceptors, then that triggers another reflex in the autonomic nervous system that sends signals down to the heart and blood vessels to speed up, to get more blood. So it's this kind of back and forth all day, nanosecond to nanosecond, whatever it is, control over blood blood flow to our brain, the rest of our body too, but especially our brain. And so that's more of a long-term system. So that's more like, that's all day long, that's really, really important. But there's another system and another reflex called the vestibulosympathetic reflex that comes from, you guessed it, our vestibular system, our balance areas, that is much faster than the baroreflex system. In the vestibular reflex system, what that does, it fires fast and it helps us understand how much blood flow we need when we're getting up, or when we're moving our head, or when we're moving our eyes, or doing all these different things, when we're doing all these very integrated tasks that's really needed to understand, we need to adjust how much blood goes here and here and here, because we only have 5 to 6 liters of blood. It's not enough to be everywhere at once. So we have to be able to move it around and get it back up to the brain when gravity wants to pull it down. So we have this system that's really involved with helping us pump blood back up. Now, if there's a problem in this vestibular system, which often happens after concussions and different types of neurological conditions. And, you know, you may have it and just, you know, may have had a virus a long time ago. You may have, you know, all these different things, COVID, whatever. And they now do not send information through this pathway very quickly. And so it gets slower. So what happens is this whole process becomes problematic in the autonomic nervous system, and now we're not getting good blood flow to the brain. And so now we're not getting good blood flow to the brain. Now we're starting to get brain fog. We're starting to get migraines, headaches. We're getting dizzy, lightheaded. We're getting disoriented easily. Our brain's getting fatigued. We're kind of getting emotionally dysregulated. We're kind of edgy and those types of things. Maybe have some digestive shifts. And we're getting light and sound sensitivity and all these types of things, maybe some imbalance too, but visual changes, eye tracking changes. And so we start to get errors in all these systems. And then the baroreceptor reflex, this system tries to do all the work. And when you ask something that shouldn't be doing that much to do more, a lot of times they fatigue and they crash and they have problems and they can't continue to coordinate at the level that you need them to. So we get a whole host of compensations and problems and symptoms that come from not only the original issue, but also now this issue as the baroreceptor reflex starts to decline or to shift in its, in its modulation of blood flow. So what's really important to understand is that if there is a problem in this system, we're going to have a problem in other systems. And so there's one more connection that I want to tell you about the vestibular system, and that is the connection to the body. It's called the vestibulospinal pathway. There's a lateral medial. And what they control and mediate are a lot of our stability and movements and coordination of movements. And so when you have a problem here, a lot of people have tightness in their neck, tightness in their upper back, and they're trying to like hold themselves tight because their body's not really moving well, and it's not integrating and coordinating movements the way it should. So we're going to start to get problems here. Now, there's a cool connection to these lower vestibular nuclei and these caudal vestibular nuclei that come up here, and that's actually from the legs. The big hip muscles of the legs come up and fire into this area, the same area of the brainstem that sends information down to that autonomic system, shares the same pathway as those vestibular inputs. So when we have healthy hip and leg muscles and our joints are moving really well, that's actually really helpful for our blood flow to the brain. So that information, when we're laying down, fires first. As we start to stand up, we kind of we contract these muscles of our lower limbs. And what they do is they send information prepping or priming these vestibular nuclei in this pathway to say, hey, we're about to get up. We need more blood. That should coordinate well with our vestibular system. And so they should be talking and saying, okay, we're understanding this is all happening, of course, in split seconds, but they're going to coordinate the activity so they can specifically adjust how much blood we need for the brain. And when they do that, we don't miss a beat and we have no idea what's going on because it's doing it automatically. So we want to have really strong leg muscles. We want to have really healthy hip joints. We want to have good pelvic and lumbar mobility and chiropractic and these types of things. And PT are really important to keep these things mobilized because they help our brain. And if they're not working well, then guess what? Our brain has to work harder. So this vestibular system and these systems have to work harder to compensate. So what I'm hoping you're understanding is that the vestibular system is actually the major conduit of how all these things work together. But if that's not working well, we're going to have all these compensations in different areas. It's going to feel like there's a lot of things going on, but there's really often not. There's really often just a vestibular integration issue that's not integrating well with the visual system. The inner ear not integrating well with the body, integrating well with the autonomic system. And all these things are playing off each other, and they're creating all this just general huge combination of symptoms that really creates what people come to see us for, which is functional neurological rehabilitation and these symptoms that they're having, and they don't know where they're coming from because you can't see this stuff on MRI. You can't do a blood test and see the eyes drifting. So we have to do specialized testing that can detect these things, and then we can deduce where they come from because we know what each thing should do. So when an eye movement's doing what it shouldn't do and it's going in this direction, we know, oh, that's the X part of the vestibular system, or that's this part, and then we can target it with specific retraining exercises. Then you see, oh my gosh, now my eye tracking is better. Oh, now my balance is better. Oh, now I can think clearer. Now I don't get fatigued in the middle of the day so quickly. Now I can look at screens and not have a problem. Now I can drive and I don't get sick, or I don't get headaches, or I don't get visual migraines and all these different types of things that occur. And I don't have back pain anymore because my brain is now mediating the right messages down to my muscles and joints so that we're not having problems. So it's really important that these systems work well. And so one of the treatments that we do for people that's kind of interesting, and that if you're a patient here, this will be interesting for you, is we do the leg complex movements because of this connectivity to the vestibular nuclei, the caudal vestibular nuclei, which communicate with that autonomic nervous system, which have a very strong impact and effect on that pathway, can strengthen that pathway, which then helps the vestibular system heal, which then helps the brain heal, and get that communication back to a higher and normal level, so that now your blood flow is even throughout the body, or in the sense of where you need it, when you need it, and you can live really happy and symptom-free. So